Hello everyone, I'm Dr. Anwitha Varmudy, consultant nephrologist at Indian Hospital and Heart Institute, Bangalore. So today I'll be talking about a disease called as CKD or chronic kidney disease. Chronic kidney disease, as is seen in the definition, it is a disease of the kidneys where the kidney is abnormally functioning or not functioning for a period of 3 or more months. It is very common in India with almost 10% of our population suffering from the disease. Why is it important for us to know about CKD? CKD is seen to affect patients with diabetes, hypertension, kidney stones, abnormal kidneys seen from birth, and many other diseases. As we all know, diabetes is a very common disease in our country, and our country is set to become the capital of diabetes by 2040. So, we have to know what are the signs and symptoms of CKD and how to test for it and what is the treatment available. The symptoms of kidney disease include poorly controlled blood pressure, passing of abnormal colored urine such as red colored urine, black colored urine, presence of frothy appearance of urine, presence of decreased urine output, swelling of legs, swelling of face, itching in your body, very high requirement of blood transfusions, persistently low hemoglobin, and many such symptoms. Which is why it is important that you approach your doctors when you develop any of these symptoms, especially if you have underlying diabetes, hypertension, and other risk factors for kidney disease. CKD can happen even in children and young people. Hence, any of these symptoms should alert you to approach doctor at the earliest. So what are the tests which can detect CKD? The most common test which can detect CKD is blood test known as urea creatinine. When these tests show abnormal levels which is persistently present for more than 3 months, it is possible that you have CKD. Hence, even one reading of abnormal creatinine, you should approach your doctor so that we can prevent your disease from progressing to CKD. Other tests that can detect CKD include urine analysis, urine protein testing, and ultrasound abdomen. Abnormalities in the test again will help us determine what is the underlying cause for CKD and what are the possible treatments that can be given. The other complications that can be detected by your blood test include detection of anemia by CBC, detection of low calcium or high phosphorus that can occur in CKD, which is also detected by blood test. So, what are the treatments available for CKD? So, treatment of CKD, it is very important to understand that treatment of underlying disease is the most important treatment. Why is it necessary to know? Because patients usually expect that there will be a specific treatment to reduce creatinine, which is not so. We have to first identify the disease and treat the disease, such as if it is a big stone that is causing blockage and recurrent infection, that has to be removed. If it is poorly controlled sugars or diabetes, poorly controlled blood pressure, that has to be treated, so on. Other than that, treatment involves treatment of complications such as treating low hemoglobin, treating high phosphorus, low calcium, treatment of elevated acids in your blood secondary to CKD, and in the later stages of CKD where your body is not able to excrete enough urine, we will have to give tablets for the same, and in the last stage, dialysis is the treatment of option. So does that mean that your quality of life will become poor with CKD, that you have to lose hope with CKD? No. CKD these days can be treated in such a way that your lifespan can be increased to much beyond as how much was possible previously. Other treatment that is available is liver transplantation. So early detection of CKD, approaching your nephrologist at an early stage will ensure that you are able to access all these treatment options and live a healthy and happy life for as long as possible. Thank you.
Indiana Hospital and Heart Institute. Aid. Inspire. Aspire.